As an advocate, adjunct professor, and special educator, inclusion is a topic of great importance to us at ED101 and a theme of the Council for Exceptional Children's recent international conference in Riga, Latvia. I'm proud to introduce Dr. Cathy McLain of the MAC Association for Children and Stepping Stones International, who presented with me at that conference. Cathy is based in Virginia, but does most of her work in the former Soviet Republic of Georgia. Welcome, Cathy. Could you tell our viewers a little bit more about your background, your research, and your work with special needs populations overseas?
Hi, Ted. I'm an educational psychologist working primarily in Republic of Georgia, like you mentioned. Although I've worked in in the last couple of years, I've been working in all three Caucasus countries, which include also Armenia and Azerbaijan. For many years, I worked in the U.S. as a traditional school psychologist, and then overseas consulting with various international organizations and international schools in Asia, Africa, Europe, and Eastern Europe. I arrived in Georgia about 7 years ago with my husband, who was working at the World Bank at the time. I began helping a Peace Corps volunteer who was working in a rural part of Georgia develop a center for disabled children. But when I first got there, I was shocked not only by the poor conditions, but also how children with disabilities were treated. I had seen this in other parts of the world, such as Africa, Croatia, other countries that I'd worked in, but this was the first time that I had been directly involved. I became more involved, and here I am 7 years later with a retired husband and an NGO named MAC, which stands for McLain Association for Children. Our primary work has been developing a model for developing programs for children with special needs in the rural areas of Georgia and other countries in the Caucasus. The reason we focus on rural areas is because there are more challenges, such as limited transportation, undrivable roads, less access to resources, such as doctors, therapists, and adaptive equipment. We have a holistic approach. We train paraprofessionals and teachers to provide service for children in the home and at school. Our outreach program is particularly important because most of our children cannot leave their houses physically or apartments. It's holistic because we have for the last 3 years paid for operations and free medications for children whose families cannot afford it. When a child needs a brain shunt, it's difficult for a parent to focus on academic needs.
Cathy, probably many of our viewers are really not familiar with international development and the educational field overseas. You did work here in the United States in Virginia in our school systems, and then also you've worked in several school systems all over the world. Could you maybe talk a little bit about the similarities and differences of working overseas compared to the United States?
Sure, there's lots of similarities and differences. For example, I'll start with the similarities. All parents love their children and want the best for them. That is universal. When I first went to Georgia, I was told that parents, and this is also true of other countries that I've been to, that parents were embarrassed about their children and kept them hidden in back rooms. When I actually began working with children, I discovered that wasn't true. They were definitely kept in the house, but it was more because other people were embarrassed to be around their children. These parents love their children. They will spend any money they have, any resources they can sell to help a child get an operation, to get a piece of equipment if they're able to. Of the 500 children I evaluated in their homes in the districts I worked in Georgia, I only found one child that was neglected. And I think in the U.S. you'd find about the same. Parents love their children and will do anything for them. Another similarity is that in poor countries, many governments are responding to the need for support for children with disabilities. And I'm seeing that in the Caucasus as well. In Georgia, for example, where I spend most of my time, the Ministry of Education is in the process of developing policies and sending people abroad for training. And the concept of inclusive education has been formally launched. In fact, some experimental inclusive programs have already been started. The differences, there are many differences. U.S. special needs education is addressed in a broader way than in poorer countries like Georgia. In the U.S., we include children with specific learning disabilities as well as physical, intellectual, and developmental disorders. Because we're a rich country, we can spend much more on training of teachers, providing services for children and their families, and doing accurate assessments. Usually teachers in the U.S. who work in special education have master's degrees. We have well-trained psychologists and support therapists, and we include parents in our decision-making. And maybe most importantly, we have a higher standard of regular education to build upon. Most of our U.S. teachers understand concepts such as positive reinforcement. This doesn't mean they practice it, but they know it. And keeping a portfolio for a child's work. Teachers in the U.S. are also expected to continuously update their knowledge and skills. This is not easily done in Georgia since internet and access to resources in Georgia are widely spread. In the U.S., teachers understand that a child with a disability probably needs an individualized program and deserves an education. And we also have good evaluation procedures and instruments such as the WISC, Woodcock, Johnson, Bender. There are hundreds of tests that are considered pretty good. In the Caucasus, all of these concepts that I discussed before are new. Disabled children are those children that in the U.S. we would consider more significantly disabled. Children with mental retardation, wheelchair-bound children, epileptic, and autistic, but not learning disabled or even ADHD. There are only a couple of standardized instruments, but mainly used by the university. When I do teacher training in Georgia, I have to teach skills that are basic 101 teaching skills in the U.S., and I'm usually looked at skeptically when I discuss concepts such as positive reinforcement, behavior management or plans, or that the idea that children with disabilities do not carry diseases. When I talk about learning disabilities, everyone's puzzled. Those are just lazy kids, most of them say when I describe them. There's no way to truly identify a learning disabled child in Georgia, and truthfully, it would be difficult to sort out confounding problems such as poverty, family or behavior problems. Some children go to school with no books for years and miss school every year during harvest time. The children the government identifies as having disabilities are those children registered at health clinics and who collect a small stipend from the government. Those are the kids, when they talk about disabled children, and that's not just true in Georgia, but most developing countries. They're talking about really fairly significant disabilities. Yeah. In the U.S., we also have a strong sense of confidentiality, while in poorer countries like Georgia, when I would visit a family to do an evaluation, we often had the whole village there. In the beginning, I would try and chew them out, but I was only agitating the family whom I was visiting because it's considered rude to tell a neighbor to go home. Plus, discussing one's problems with everyone is actually considered normal. Teachers do not discuss a student to his parents in private. All the parents are there of other children. When you go to a doctor, you must often stand in a room with other patients while the doctor goes from one patient to another with everybody listening. So confidentiality was something I was at first teaching and realized, and I still do, but it's one of those things that goes through one ear and out the other. So, those cultural issues are really important to understand.